Modern medicine approach in varicose vein treatment is focused on surgical removal of the vein or shrinking or destroying them with laser or injections. However, often the problem returns after some time. Here we see how a patient who needed repeat surgery from such recurrence and was also on multiple medication for comorbidities like osteoarthritis of the knee, diabetes, hypertension, cholesterol, etc., was able to avoid surgery. We also learn about the time needed to overcome the discomforts, the process and time by which the medication for diabetes, hypertension and cholesterol were reduced and stopped, and also how lab tests helped to evaluate progress in the disease parameters, which helped justify reduction and stoppage of medication while simultaneously revealing improvement in health parameters of the patient. This series is about my experiences with the patients who took clinically supported lifestyle correction to avoid surgery and taper of medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on undergoing surgical procedures or continuing with the lifelong medication. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with the lifestyle modulation, etc., you may search our YouTube channel. When we come to the details of the patient, this is a 65-year-old female, height 163 centimeters, weight is 65 kg. Medical history shows that she's having varicose vein for more than 30 years and undergone surgery 20 years back. And now she is advised for a repeat surgery because of the pain and discomfort. She is suffering from hypertension for the last 10 years and on medication, and cholesterol and high triglyceride, that is dyslipidemia, for the last 8 years on medication. And she is having leg pain. That is her major problem. She is not able to stand or walk for even with little walking, she finds it very difficult. And also itching and discoloration of the skin, especially on the lower limb. That is because of this varicose vein. And some lesions, ulcers also is there, that is irregularities in the skin. And arthritis, knee, severe pain, and it is deformity also. And then when you look into that on examination, their knee is deformity is there, and also foot deformity especially, and even the toes are alignment is damaged, and it is hallux valgus is there, hallux valgus deformity. That is mainly, it's a type of rheumatoid arthritis actually. It is very common with this varicose vein patients. It is very common to see this skin problems, definitely darkening, itching, and skin lesion, ulcers, and bleeding. That is the most common complications of the varicose vein. And also usually these patients will gradually develop this deformities on the foot, and definitely this arthritis, osteoarthritis of the knee also will be there. Here basically the arthritis of the knee is osteoarthritis, but of the foot and the toes is mainly showing it is a type of rheumatoid arthritis. So multiple diseases are actually, multiple factors also playing a part. Then when we come to the surgical history, she had undergone varicose vein removal in 2003 and uterus removal in 2001. That is for the actually bleeding, uterine bleeding. When we come to the family history, her mother also had the same problems, varicose vein was there. And when we, with the initial diagnosis from the history and the examination, varicose vein recurrence is there, that is stage 6 actually. It's a it's a advanced varicose vein, that is after surgery recurrence actually, and need a repeat surgery. That is what the modern medicine surgeon has advised, a specialist in vascular. This sort of Kerala, almost all the aspects is treated by specialist, and this not the general surgeon, it is a vascular venous surgeon actually has advised further procedures. And for the knee replacement surgery is advised. And actually, she's having not only knee problem, but the ankle and the toes and all having problem. But those joints we don't have facility for, or the orthopedic surgeons doesn't have the facility for replacing those joints. But the comparatively easy is the knee replacement, and she was advised for the knee replacement. And she's on hypertension medication and also statin for the dyslipidemia and cholesterol. Next, we'll see, just before starting lifestyle correction with the clinically supported lifestyle correction, what is her stage on the day 1 or just before. And main problem is the leg pain. And she's not able to walk or not even able to sleep properly because of the pain and discomfort. And frequent cramps also, muscle cramps also coming. And leg edema is there, and skin itching and darkening of the skin and itching and ulcer formation is there, and deformity of the foot and dilated bulging veins from the thighs and the cuff. And when we look into the medication, she's on rosuvastatin and telmisartan for BP and metoprolol, that also for BP, and biotinic and a C-cot and a vitamin D3, that is maybe because of this, and neurobind, that's all vitamins. And when we come to the blood report, her HbA1c is 6.2. She's already started with the diabetes also. She's on medication for the pressure and cholesterol, but now she's on many diabetic medicine also. And the GFR also, that is glomerular filtration rate, that is the indicator or early indicator of renal dysfunction, kidney problems. It is reduced to 86. Ideally, it should be above 90. And ESR is 57, that is high. It shows that inflammatory marker. And thyroid function also slightly derailed. And from the allergy test and intolerance test, it shows that she is allergic to many common food items and also some inhalants, and this dust mite allergy and so many allergies also is there. When we come to the final diagnosis, after this investigation also, she is having recurrent varicose vein after surgery. That is, she had done from the scarring shows that it is a stripping was done this 20 years back. That stripping means that a surgery, that removal surgery for the varicose vein is actually taking away this superficial venous vein, that is called as a venous vein, is taken away. The major problem with when you are taking away this venous vein, actually this vein is used for this bypass surgery and all. When we do the cardiac surgeon do the bypass surgery, they harvest the vein from the calf actually. That is, this vein is harvested, that is superficial vein. But if you are removing for this, when we are removing the chance of harvesting the vein for a bypass surgery is not be possible. But if the patient is going for a clinically supported lifestyle correction, actually the patient won't need this bypass surgery as such. And also, but if at all it is not for the bypass surgery, but for other reasons, some tube is needed or some replacement is needed, definitely that will be there. So avoiding this sort of removal is always better. So when the stripping or even this doing laser surgery or sclerotherapy or anything, if the saphenous vein is damaged, so your possibility of getting the future harvesting of the vein will be lost. Next, her problem is arthritis of the knee, that is of this osteoarthritis, that is the thinning and the damaging of the cartilage. And on the foot level, it is the rheumatoid arthritis sort of deformity is there, hallux valgus and deformity. And definitely she's on antihypertensive and statin for and with the new investigation report, she's diabetic also. And body parameters shows she's overweight. She's not even obese, but she's overweight. And when we come to the disease category, it is metabolic syndrome and autoimmune disease. Now, the latest understanding is that this varicose vein and osteoarthritis and even rheumatoid arthritis, previously we are thinking rheumatoid arthritis is autoimmune, but we are not knowing what is the reason for this varicose vein and the osteoarthritis also. But basically now it is we can say it is degenerative disease, whatever it is, because of the immune system is malfunctioning, this is happening. So we can take it as autoimmune disease. Next, what is the difference between self-lifestyle correction and clinically supported lifestyle correction? And what is done in that? Basically, lifestyle correction is intending, or any self or with the clinical support. The aim is to provide the body what is the optimal amount of nutrition, optimal amount of exercise, and reduce the toxins inside the body, and prevent more and more toxins coming into the body. Even the medication, any medicine, we can consider this as a toxin, because if it is not a nutrient, it is a toxin for the immune system. Whatever we get into our body, either as a food or as a medication, our liver and kidney has to metabolize it and remove it. And the immune system is always struggling for removing all the toxins. And actually, the immune system is controlling almost everything, not only fighting the infection. Everything, even the growth, development, maintenance, everything is controlled by the immune system. So, we in this giving optimal nutrition, optimal exercise, and optimal reducing the toxin, we are trying to rebuild the body. Body is always changing. Every minute, every second, lot of cells are born and lot are removed from the system. So, in that, body's regenerative capacity is made use in this clinically supported lifestyle correction with this clinical support is given to make the patient understand what is the peculiarity of their body and what all things is ideal for her body, especially in the form of food, to provide optimal nutrition from the most tolerant food. And also, for a person with the arthritis and not able to walk, they need special type of exercise which can be done on the bed itself. They cannot go for a walk or running or anything is possible for such patients. Next, when we come into the details, what was the progress of the clinically supported lifestyle correction? What was the changes which has happened to her? The symptom-wise and how fast the symptoms was relieved. Actually, by the 8th day, after starting clinically supported lifestyle correction, review will be on the 8th day, 15th day, then every month, 30, 60 and 90 days. By the 8th day itself, when she came, her pain was reduced substantially. Almost 30 to 40% pain relief was there. And the edema of the leg and the itching and ulcers, that's also almost healed. Edema is almost gone and the itching is reduced. And the skin ulcers also has almost 80% is healed. By 15th day, all this edema, itching and the skin ulcers become clean. Only the darkening and deformity and dilated vein, it will take more time. And by the 15th day, the pain is almost 50%, even walking, only sitting there is no problem, she can sleep comfortably. But walking, there is pain is there still, 50% relief only. And by the 30th day, 70% pain and she is able to even climb the stairs without much discomfort. And by the 60 days, pain is almost nil. And all the symptoms wise, the discomfort wise, it is completely relieved by 60th day. But the only remaining problem, that darkening of the skin is continuing. By 90 days, only 60% reduction is there. Especially that point where already surgery was done. That point is scarred and there is darkening is there. That we cannot expect any fast variation in that. Maybe it also get lighter, but it will take some time. In this varicose vein and the arthritis, special nutrition oil also is given for the massaging also. This will be absorbed directly into the veins and it will healing not only through the oral food. Give this for the skin, this special skincare oil application also is done. So that is the reason for this very fast healing of the ulcers also. In this actually we don't use usually, if it is only severe infection, affected ulcers, only antibiotics or any medicine is used. Otherwise only this special nutritional oil itself will make it, fast healing will be made it possible. Next, about the medication, what was the changes? What happened to her, this cholesterol and BP and all? Her statin was reduced to, by the first week, because even with the medicine, the cholesterol was slightly high. So we didn't stop the statin initially. Then gradually by the 15th day, the medicine, cholesterol medicine, we were able to stop, and the cholesterol was okay. By the 30th day, without medicine itself, the cholesterol was okay. The telmisartan and 2 BP medicines was there, telmisartan and metoprolol. Both first telmisartan was reduced and tapered off, then metoprolol also. By the 30th day, there was no medicine she was taking. All the other nutrients and all, supplementary nutrients and all she was taking, that also was stopped on the first day itself. Next, we look into what are the blood parameters it was changed. Her HbA1c was high, and it was 6.2, pre-diabetic level only. It was not knowing that you are diabetic. And it was reduced to 5.9 on the 8th day, and 5.7 on the 15th day, and 5.6 non-diabetic stage by 30th day. Usually, for the diabetic patients, the modern medicine doctors, as a monitoring only every 3 months it is checked. But when we start with the clinically supported lifestyle correction, on the process of in the initial correction stage, we check it every week initially, and then every month. Because we want to, that is the most very good indicator for whether the patient is correct, following the things correctly. If it is the patient is following correctly, every week the change will be there. And what we are always expecting for the diabetic patient, the result, the HbA1c should be corrected within 3 to 4 months, because the hemoglobin, RBC's lifespan is 3 to 4 months, 120 days. So if the patient is correctly doing everything, whatever is the HbA1c, even it is 12 or 13, it will come down to around 6 or 5.2, this normal level within 3 to 4 months, depending on the age of the patient and how strictly they are following the low carb diet. And her GFR was high, 86, and it is actually by the GFR, was only marginally changed. It is, we checked it 30th day. By the GFR is the indication of the kidney disease, and early kidney is affected, early kidney failure it is indicating. But it is came up to 93, that is more than normal, 90. Above 90 by 30th day. And ESR, that is an inflammatory marker, and that was 57, and it is came down to 23 by the 8th day itself, and it was maintaining by the 90th day also is 21 maintaining. And initially the thyroid function was slightly abnormal. It also came to normal within 15th day itself, the thyroid function came to normal. Next is the body parameters. In the clinically supported lifestyle correction, what we are trying to correct is in the body structure or body composition we are trying to correct. And the correction is aiming at the cellular level itself. And her body weight was 65 kg, and it came down to 60.9 by the 30th day. And by 90 day, it came down to 58. Actually, weight reduction is slightly in the lower side. But okay, she was not just so only overweight, she is not obese. And what is ideal for her will be around 55 kg, maintaining at 55 kg will be ideal for her. That we are expecting by the 180 days, actually 6 months we are follow up also. And this BMI was 24.2, that is ideally for an Indian, it is 23 is the high maximum. It is always better. But especially at 65-year-old people, that is the senior citizen, always keep the BMI in the low normal. Therefore, the Indian's law is the 18. But keeping it between 18 and 20 will be the idea. That is what we are expecting for her also at the end of the treatment. And BP, initially she was on diabetic, this antihypertensive with 130/90, but by the after treatment it is 120/80, 110/70 only by the 90th day without medicine. And abdominal circumference was 81 initially and came down to 70. And ideally for her will be around 65 will be ideal. And her body age was 67. 2 years accelerated aging was there. And it came down to 59 years by the 90th day. So she is actually 65. Now she is younger than what is her real self. Real self is 65 years calendar age. And it is now by 90 days he is actually came down to 59, means almost 8 years change is there, and the three. And it is not in the, just it's not digital. The patient will be able to feel it, the change, the youngness and the energy and activity level increasing also. They can feel it. And the fat percentage was 35.7 and it is came down to 30.8. And ideally it should be around 25. At least if you are able to, at this age, at least if you are able to keep, for the ladies, less than 30 will be okay. Now we'll just glance into the what was the before and after status. The symptom wise, her major problem is leg pain. She is not able to sleep or not able to walk properly. If we are walking, the pain, that is two problems are actually hindering her. One is three problems are there. One is varicose vein and it is ulcers and other problems. And her osteoarthritis of the knee and the rheumatoid arthritis, it is affecting the leg, this foot and ankle. So all, and along with that the edema, itching and all this discomfort, all the primary discomfort like this pain and itching and those things has disappeared within 2 weeks itself actually, almost within the first month itself it is gone. But the darkening of the skin, deformity, dilated veins, those will not be that easily get corrected. Symptom wise, the patient will get very fast result. That is what we always see. The symptom, the pain and discomfort will be reduced very fast, within 1 or 2 weeks itself. That is why it is, because our immune system cells and the lining of the blood vessels and all will be changed within a week itself. But not that lifespan is only 7 to 10 days. That's why this fast result is about the symptomatic relief. But the deformity by dilated vein, it will take long time, gradually. But there was a reduction of 20% reduction was there on the dilatation of the veins and also about the deformity also. Next, we'll look into the medications what we are taking and what was at the beginning and what was the end. Actually, she was taking almost 6-7 tablets, especially for the statin and BP medication and some nutritional supplements and all for this arthritis and all. So all the medicines is over. And when the blood report, she had diabetes, decreased GFR, inflammatory markers, thyroid markers was increased, but all these abnormal parameters has came corrected within a month or two itself. And next is body parameters. She was overweight, but by the 90 days she came down to 21.9, normal BMI pattern, 65 to 58 kg. And on the BP, we have already said 130/90 with medicine and 170 without medicine. And abdominal circumference. Abdominal obesity is one of the major factors which is hindering this blood circulation, this increase in venous pressure and this varicose vein. And even when the weight is reduced, the strain on the leg, even the knee and all is reduced. So her weight came down from 65 to 58. Ideally, she should bring down to 55 at least. And body age was 67 and by the end it was 59. That is 2 years accelerated aging and now it is 6 years younger than what is her real self, that is 65. And fat percentage also reduced from 35.7 to 30.8. So what is we are planning to bring her future is actually 55 kg, BMI around 20 and maintain the BP without medicine. And the abdominal circumference also is ideal will be around 65 and keep her body age as 55, that is at least 10 years younger. That is all possible. That is only the patient should be compliant and they should also have that interest. Next we will see what are the advantages the patient got moving from conventional modern medical treatment to this clinically supported lifestyle correction. What will happen for this patient? If she is continuing with the modern medical, this conventional modern medicine, this clinically supported lifestyle correction is also a modern medical approach only. But for the conventional approach, varicose vein means repeat surgery and different mode of surgeries are available. Laser surgery is there, sclerotherapy is there, this few more adhesive chemicals and all is there. So even the steam therapy, ultrasound waves using probes for the destroying, everything is for destroying the blood vessels. We cannot, for the surgery, we cannot rebuild anything, we can only destroy. So destroying and that will give only cosmetic benefit. Actually for this patient also, she has undergone 20 years back this stripping surgery. That is actually given benefit only the cosmetic benefit. That time she didn't have much of the pain or discomfort like this. Only because of this pain is there. Many people think like that. If you remove the pain, early stage itself, then the disease, you can prevent the disease. But these blood vessels are needed for the body. That is, with your intrauterine life, these blood vessels are formed. So if it is removed, how can the blood will flow? So that is the reason when we do this surgery or sclerotherapy, etc. After some time, the leg will become darkened. This patient also is the same. And the leftover veins or some new veins will be coming up also, that will also get damaged because the root cause we are not addressing. That is basically nutritional imbalance and intolerant food taking and such things. So this patient, she's already is diabetic also, hypertension, definitely the surgery. She was advised for the varicose vein surgery and also the knee replacement. That's all major surgery. Varicose vein surgery will not produce much discomfort, but the knee replacement surgery is a major surgery. It will, the next 3 months will be really painful condition. So she was able to escape all those things, and she was able to symptom free, and she is able to walk much better than even after a knee replacement surgery within 1 month itself. And her varicose vein problem and the arthritis, rheumatoid arthritis, osteoarthritis, all these problems are reduced actually. And the diabetes, she is pre-diabetes. Definitely if they go for surgery, she has to take diabetic medication, especially when a major surgery like knee replacement. And also they will put on weight also, because after surgery, both the surgeries definitely rest and food, the weight gain, and again this medication for the BP, cholesterol and diabetic medicine has to be increased too. So many extra medications, future medications, and diabetes and hypertension can get a heart attack or blood vessel blocks. For that also aspirin, those things also has to be added. So in conventional way, more and more medication, more and more surgeries in the future for the complexities and the problems she has to take. But here with the clinically supported lifestyle correction, that is actually all these diseases she is suffering from is lifestyle origin. So for the lifestyle origin diseases, you have to correct the lifestyle. So the result also is very fast. Usually people will think that, I thought it will take 5 or 6 months for getting it's not like that. If you go correctly, like lifestyle correction according to the protocol, you get very fast result, and no medicine can give this fast result, or no surgery. Surgery will definitely bring again pain. And also when the future surgeries, everything is over actually. If she's maintaining like this, if she's able to maintain this health, she can, the current problems and the future problems can be prevented at very large extent. When the immunity is concerned, whenever you are taking a medication, it is actually giving a challenge to the immunity. And when a person or the patient is on medication or having a disease, if a new disease or a new problem, health challenge occurs, you become a complex patient. That is, if this patient after this condition, if she get a cold or even pneumonia, it will be very easy for the recovery. But when she is on medication or for the diabetes, hypertension, etc., if a complication like any infection or a wound or anything occurs, she will be put in the medical terms it is called as complex patient. So recovery will be very difficult. And actually this patient was planning for actually she was not even able to walk in the initial stage, but she has decided to go to I think Canada or US for looking after her grandchildren actually after 3 months. So that was the result. Actually she is able to, before that she was not able to do her own basic work, but after that she is planning to go abroad for looking after grandchildren actually. So that is the difference. And even she goes there also at this situation because she is medicine free, symptom free. Getting acclimatizing with the new atmosphere or the cold situation and all will be much more easier. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of the toxins by improving circulation through optimal stimulation of all cells by the planned exercise. Third, minimizing toxin entering the body through food, water, air and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. It is good to understand that neither medicine nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect, when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from government service and in 1997 started practicing as consultant at Life Care Center, Devara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to the humans but also all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications to protect our children, grandchildren and the coming generations from the ill effect of the toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning surgery for lifestyle diseases. Thank you.